Good morning, Charles.
Good evening, Mel.
Aloha Friday, brother.
Yeah.
I figured you're the clueless one, so you wouldn't know the difference if it was morning or night or Monday or Friday.
Well, I
Eh,
went in this morning. I went in this morning about 3:45, and I came home at about 6 o'clock.
wow. That's why you gotta have your coffee, bro. I went back to coffee, Charlie. I went back to coffee.
Well, I just said,
Get my blood flowing. Get my blood flowing. We got an awesome show tonight. Um, it always is an awesome show at the start. Hopefully, it ends up that way. it's I don't know what to say, Charlie. I don't know what to say, man. It's just some things you just gotta shake your head.
well,
And we'll talk about that tonight.
there's
We'll talk about
there's a
that
lot of
tonight.
questions I do want to ask, and it's not anything to put our guests into a tight spot, but I just want to get their take on it because I followed one of our guests tonight quite extensive during the political times that we were involved with, the races here on Hawaii. And even though he seems somewhat very reserved in his responses, I have to say that that's a lot of wisdom being shown on that hesitancy because he's always looking at what is the for every action there's a reaction, they say, right? So whatever he puts out, he wants to make sure he's prepared for whatever comes back. So I say that's a lot of wisdom. It's just he's not he's not like some of the politicians where they shoot off the cuff, and if you're very target specific, you hit your target. But if you shoot with a blind eye, that's why they always say, like with cops, right? You never shoot if there's people standing behind the suspect, because if you can't guarantee the shot, you will hit some innocent people. And I think he was very, very cautious and reserved in some of his responses that made you know that made me open my eyes. At first, I thought, I said, "Oh, this guy, this and that." But you know what? I I I had to ask the Lord for forgiveness for what I said, because then came I started to see him do what he did, and I said, "Man, now that is wisdom he's doing." So now I pieced it all together and I said, "Yep, now I can see why he did what he did, or what he said, what he said." So
Oh,
given that, I am prepared, brother. I am prepared that you know for a good show tonight.
I'm excited. I had met Mayor Kim on several occasions. It was in passing. It was at functions, legislative stuff, and
Mhm.
but I always was impressed with his demeanor. He was always so mellow, like you said, Charlie. Very slow moving, very it was very targeted. I guess that's you nailed it, targeted. And I had a chance to speak with him on Saturday, I believe. Um, and inviting him to the show.
Mhm.
And I wish I had known him personally early on in my political career. In that short 15 minutes, I learned so much about leadership, Charlie. I got to tell you, I, I always, and I'll share this when he comes on because I want him to hear me. I want him to hear me thank him for what he did for Kauai, and I'll share that in a little bit. But um, I just have a whole different level of respect for this guy because he's anyone that is in politics technically is a politician, but you have politician ways of doing things, and then you have practical ways of doing things, and he's a very practical guy. He kind of reminds me of Kaipo Singh, come from that era where very meticulous, very thought thought provoking. He's just And you're gonna see that tonight. Like I said, I we spoke only for about 15 minutes, but gosh, man, I could sit with this guy for hours and just
Mhm.
pick his brain on, and he'll share a lot of that tonight. We also have Dr. Miscovich on. We brought Miscovich was the one that recommended we bring on Dr. Mayor Harry Kim. So I want to thank Doc Miscovich for that. But he's going to be on to basically answer any questions or talk about what's going on now, especially with the schools. Especially with the schools, and I am going to put up the slide that with the new guidelines that came out today. you know, a week before school, typical state. But we'll talk about that tonight because a lot of people are concerned about their children going back to school at a time when many
Well,
of those kids cannot even
let,
get vaccinated.
let me say this about our guests too. Well, both guests, but I'm focusing on the former mayor, and we still call him Mayor Kim. Um, his previous role as a civil defense, right,
Mhm.
coordinator for the Big Island of Hawaii. Anyone that can time lava flows, where to be, when to get out, anybody that deals around that realm that just knows how Madam Pele works. I give that person credit. I give that person credit. And I think he did a pretty damn good job. I think he did a
Oh,
pretty darn good job.
absolutely.
And it,
Again,
yep,
no, being the meticulous guy, people wanted him to do things quickly, and he took, he did it the right way, I think. And I think most of the people on the Big Island would agree. Most of the people on the and I know some of you don't like us calling the Big Island Big Island. I apologize. You know, it's Hawaii Island. It's listen. I mean no offense, guys. That's just how I was raised. That's how I was brought up. So if I say the Big Island, no offense intended. It's just the way we were taught growing up. It was the Big Island. So again, if I offend anybody, I apologize. If I slip and say the Big Island instead of Hawaii Island, but we're gonna learn a lot about the Hawaii Island tonight. I think we're gonna learn a lot about our guest, Mayor Kim. Exciting, exciting. Before we let me put up a slide, Charlie, because I kind of wanted to get your take on this. Again, our shows aren't scripted, so Charlie has no clue what the heck I'm gonna be showing, and neither does anyone else. Um, we had a concert the other night at Kilohana. It was a comedian. I forget his name. I don't even never heard of him. Apparently, he's some big comedian. And he came Gaffenberg or Gaffberg or whatever it was. Then he came out and
got a bird.
he Gotterberg, yeah, Gotterberg. he he came out at the Kilohana, and it was an Eventbrite event. So I got all my data off of Eventbrite. But I went on and saw some posts. There were several threads of people that went, and what they shared was that there was very little social distancing, very little scrutiny at the front, scrutinizing, and the biggest part, it was over 700 people by the estimates of several of the people that were there. It was definitely not following safety protocols, and I was kind of concerned. And then I just find out tonight, about half an hour ago, in fact, that where did my that the again on Eventbrite, and there's another concert being planned for August 1st. Let me just put this one up here. And this one is Kolohe Kai is going to be at the Poipu Beach Athletic Club um, on August 1st. You get tickets $37 to $65. Again, now I went to Eventbrite, and there's all the protocols about what you got to do. You got to be vaccinated or have taken a test within 24 hours of the concert at the convention hall or whatever. So all of that is in here. But what I'm concerned about is what I've been told by a very reliable source that they've already sold over 1,000 tickets. 1,000. Yes, it's an outdoor event, but 1,000 people at the Poipu Beach Athletic Club. I don't know if you folks ever been there. It's going to be a concert. It's going to be a stage, and I love Kolohe Kai. Trust me, if it wasn't COVID, I'd be one of those 1,000 guys buying a ticket. But this is COVID. This is Delta. This is a pandemic. Over 1,000 tickets sold. Now, again, from a reliable source, I haven't validated it with the event coordinators, who is BAMP is the promoters. They were the same ones that did the comedy show. How can we allow this to happen, Charlie? and maybe I'm off track, maybe I'm off base, as we and many others are trying to get the message out to be safe. Here we go, you know. So I just curious, what was your thoughts?
Well, one, if you're talking about, first of all, the event didn't even take place yet.
August 1st.
But yeah, August 1st. But like with the concert or that comedian show they had the other night at Kilohan, it all boils down to whether or not there's an enforcement arm that can take, that can actually move in there. I'm pretty sure if they had a unit like Oahu with the Attorney General's office, they would make no qualms about it. They would move in and do what they needed to do. So I think why everyone gets mad is when people start getting sick. I mean, I hate to say it, even me, I get vengeful sometimes, knowing that, okay, you damn fool, you went over there and now you're sick and you like me feel sorry for you. Wait, it ain't gonna happen. But you know what? That's not the right attitude to take. The attitude is, how do we correct the wrong? How do we correct the problem from reoccurring? And that's why one of my questions will be posed to Mayor Kim is about the way our government is handling this virus. And that is, it's almost a hands-off policy when it comes to safety. And I think that's a wrong message to send right now. You've got to get your hands involved. I understand that some people elect not to take the vaccine. I get it. But we show no promise as far as trying to handle what's within our communities now because they basically say it's local residents, it's community spread, right?
Hmm.
And you know what? Do an effort and let's strangle that thing. Let's cup that thing into an area and let's cut it off from the rest of the other communities. But it's like, you know, if you keep on, if you got brush, right, and you just keep on pouring, you just keep on pouring gas onto that brush, and as the fire gets bigger and bigger, and you get a water hose on the side and you try to put it out, if you don't cut off that source, that gasoline being thrown in there, you're just going to keep on running that thing amok. And I think that's what's happening now. And if nobody and if nobody wants to admit to that, we are just giving free reins to what is possibly known as chaos. It will come at some point. We already had debts. We don't need no more. But I don't see anything that would indicate to me that government is trying to tackle this thing like they're supposed to. So that
All
said,
right. Well,
I
thank you,
want to
Charlie.
welcome our illustrious guest that's on with us right now.
Man,
The
this is like honest. If I had a red carpet, I would toss out the red carpet, Charlie. I would actually roll out two separate red carpet rolls for Dr. Miscovich and Mayor Kim. I really would. Damn it! I wish if I was technical enough, I would be able to do that with some electronic stuff. But
I
anyway,
tell
real
you the
quick,
reason why
yeah.
you can't do that. I'll tell you the reason why, and they both will understand. Because I know you, Mel, you will not vacuum the carpet first. That's the reason why you ain't rolling it out.
Well, anyway, everybody, as you guys all saw on the promo, tonight we have Dr. Scott Miscovich. You guys all very familiar with Dr. Scott Miscovich, um, founder of Premier, what is it? Medical Health Center or something?
Medical group, just Premier
What
Medical Group.
Premier Medical Group. The one thing we know about Dr. Miscovich is he is the authority on testing. It's just not in dispute. He's been there from day one. He's tested more people than anyone else. He's been across the country, been across the world, been with the Olympics liaison for COVID. He's done it all. So we appreciate you taking some time to be with us tonight, Doc, and appreciate you connecting us with Mayor Kim. Mayor Kim, for those of you that don't know, former mayor of the Big Island, Hawaii Island, well known, well respected, well learned. This guy is an amazing dude. And one of the things that we that many of us might not know, Charlie, you may know because you were here during the hurricane, but on Kauai, Hurricane Eva, Hurricane Iniki, Mayor Kim, who was a civil defense guy at the time, was activated to come to Kauai to get us through the hurricane. So all what you've heard about the heroes of Kauai, there were many heroes, but they were under the guidance of Mayor Harry Kim. And for that, Mayor, I thank you. We all thank you. And we are just so awesomely blessed for you to be on our show tonight. But before, hang on real quick because I got to get my screen. I just wanted to show one thing before we get the mayor on, and you guys are going to appreciate this. This is one. The picture says 1,000 words, right? There it is. There it is. You talk about a dedicated troop. If you're in the military, you know what I'm talking about. Mayor Harry Kim standing on the side of the road on the big island of Hawaii, all by himself. Vaccinate for your ohana. That's what this guy is made of. Thank you, Mayor, for being with us. Yep, there we go, Charles. Give him the round of applause. How
Thank
many
you.
how many people, Charlie or Doc, have you seen go on the side of the road and hold a sign to inform people that they should vaccinate to save and help their ohana? 21.
Yeah.
Yeah,
Welcome,
that's
Doc.
Harry Kim. You know, Harry Kim has done that. The only people I see on the side of the road holding a sign is those who have been convicted and ordered by the courts to admit that they're a criminal and they hold one sign. That's the only one. But as far as helping the people of Hawaii, ladies and gentlemen, it's our honor to present to you the former mayor, about who we still call Mayor Harry Kim. Thank you for joining us, sir.
You guys embarrassing me so much. Maybe I'll leave now. The name is Harry, and sincerely, I've told several people I was going to be on your show, and how lucky the people of Kauai are to have your show, uh, to have a program that they can trust. And I do understand they trust you guys, because I think maybe even better than anybody else. There's so much distrust of us in government, and truthfully, I think we deserve it.
Mhm.
well, well, we try. We have some people out there that question what we do, but I think the vast majority of people, especially our viewers, they come on every night. They come on to learn. They come on to be informed and educated, and that's what we try to do. So we kind of wanted to get, Mayor, you were in office, and I know you said call you Harry, but I just out of pure respect for you, I apologize, but I just gotta call you Mayor. You were in office when COVID struck, and so take us on that short journey of man, when you were the mayor, there was a lot of unknowns. This stuff was crazy.
Yeah, because of this show, I dug up some old material to see at what date and what the message contact was in the first radio message to the people of Hawaii Island, and it's dated February 4th. And in that it stated civil defense will be 24 hours a day, 7 days a week, and we did, and we stayed that throughout the entire year. I think they stopped earlier this year, this calendar year. But of everything, I think I like talking to old timers, and I know I'm the oldest of you old, but you're still old timers. Uh, I tell everybody you have to gain trust. You have to be truthful. They have to know they can depend on you for not only truthful information, but timely information. And that's why in February, the governor will confirm this, and Dr. Park will left will confirm it, and Tom Travis, who was head of civil defense, will confirm it. Because in February, I made an appointment to meet with him about this thing called the coronavirus. And one thing we learned long time ago about the virus, I was a medic in the army, and a lot of times you learn things that you think is useless, but you never know. And I remember one of the main things his instructor told us, and all of your listeners and viewers should know, the coronavirus is a pandemic. Definition could be countrywide, worldwide. This is worldwide. Another thing about all pandemic, it's new. When it's new, there's so many things we don't know about it, and we're going to learn as we go. And we all have to know that. And right now, there is a tremendous change between contact transmission and airborne transmission. And if anything tonight on this show I was fantasizing about Kauai. My best friend in life when I went to college and still today is a Kauai boy. Maybe some of you know the Glanita family.
Oh,
They're
Yep.
just super nice guys, a family matter. One of the things, if anything, of your show today, understand that I'm not a doctor. It's my job to learn everything there is about it. And anytime the doctor, Miscovich, you disagree even slightly, please, I ask you to speak up. Because as you and I talk, when we leave this show or whatever we present the show, 100% of it has to be trustworthy. And just pretend that they're going to go and screen everything we say. But when we talk about this airborne, learn how different of transmission it is. When you learn about this pandemic in regards to the virus today of Delta, when you say of transmission, how much different it is from the previous strand. But one more thing, and we don't know this, I think, and we get all mad or distrustful when something new comes out, and you always hear, but you said this or they said this. It is because it is true. And on this Delta, I don't think Dr. Miscovich will disagree. There will be other strands of this virus. And so we have to know that. And one of the things, and back in February, I remember Department of Health said, we will learn as we go. And this is what we're doing right now. And if anything that I think the doctor and I agreed on tonight is to emphasize the extreme importance of what the public can do to minimize harm.
That's very, very, that's, thank you so much for saying that. Dr. Miscovich has been on our show several times, and we look to him for guidance because he's had that exposure from testing to seeing, I call it a trend, what the medical trends are. And sometimes we look at numbers, and sometimes we get engrossed by numbers that we forget what's really happening around us because we're only looking at numbers every single time. But I wanted to ask you, Mayor Kim or Harry, if I may call you that, your name. Why do you think government now? It's being shown that as far as putting safeguards in place, I know during your time when you were still a mayor, you had safeguards set up for this new virus, and now with Delta hitting the stage, its numbers are just rapidly growing. But it doesn't seem like government is putting up any kind of safety net. But all we hear is, oh, it's due to local people, unvaccinated. That's a common theme. And even though that might be true, I still think there needs to be a battle plan to help whether you're vaccinated or not. Because one thing that's happening is we're not even handling the core that we have now. And yet I definitely know we're letting more come in. So it seems like that number will never bottom out. So what's your take on the government's position and it seems almost lackluster at this point. There's no urgency.
Well, I'll take government as a whole first worldwide and talk about Hawaii along with that. And Dr. Miscovich, please jump in anytime. I think we watch all of the international things that are happening, and you're going to learn from that. And some of the numbers you see of countries like India and others is just because they are quote unquote third world type of resources. The death tolls are just frightening. If anything, because I want so much like the Dr. Miscovich, we want this to be beneficial. I think a lot of the things that you see are because there are people of different priorities in regards to what would be the best decision. I think all of us here agree that not too long ago means 3-4 weeks ago or less, I don't think the word airborne was mentioned by many people, especially in this state and many states. I don't think there was real good definition for you and me what the difference of airborne meant, uh, and how much more dangerous it is. Because as I've said to the governor and others in the past couple of weeks, because we have a new virus now, we have Delta, we have to review all our present policies of the hazards and risks. And we have to make sure that we know all the parts of state and county and decide which ones must adjust to it. When you are, and I know both of you have been, you are in the position of decision making. If you are going to measure only the health factor, it's really quite easy. It's a black and a white. It's no different than, let's take the last volcanic eruption we had. I think you were police chief. You know that if you have mass evacuation like we had in Leilani Estate, 750 homes or so, very unpredictable what the level was going to do. Just a series of different vents opening up. Some as harmless as the nights for sightseeing, right in the middle of the subdivision. Initially, we may have to make a decision. Do we do it the very easiest way and safeguard everybody? Make a perimeter line and say this whole area is on evacuation order and out, and until the whole thing is over and settles down? Or do you make the best judgment possible? What is the minimum you can do and to ensure safety? And then let people live as best as they can within that, but a commitment of watching it and warning them to evacuate in a timely way. And that's a real difficult decision to make. We made that decision. And most of the people were not evacuated until 3 or 4 weeks down the road of first eruption. This is exactly the same. Well, let's just take Kauai, for example. You have him there, and his family and I go way back, by the way, because, they're from the Big Island. And I used to coach one of the brothers. Matter of fact, I coach Victorino too. That's how old I am. But anyway, if you look at that, the decisions made, my God, I was in all the discussions, how much restrictions are made, who shall be restricted, schools, even the element of schools today, no different than that before. Do you close? When do you close, et cetera, et cetera, et cetera. If it's made only on health, as Dr. Miscovich knows, it's really easy. You say, everybody locked down. Right? Lockdown, even that is varied. How much of a lockdown, Can you go store or not? If you want to be really strict like some countries, it's delivered to you in a central place. This country, because we are the United States of America, we don't do that of total totality and to make it easier. So your leaders all over the United States and the world, I think you might have read today's news in some places are rebelling against the government because of lockdown and words from them, no more lockdown. And if you're in charge and now we have a new virus, transmittal-wise, it is so difficult because it's airborne. What will your decision be? I can say this about our government. I don't know of anyone that whatever decision they made is not based on what they really feel is best for their priorities and nothing, underlying kind of things. But I also know when we do that, there are differences. And I also know when we do that, there are grandstanders who will pick on things to make your decision look bad. And those are the kind of things that really makes it difficult for all decision makers. So the goal here is to understand, I think, why the decision was made. And I think we can do 1,000 times better job in communicating with you, the public, what the situation is and what the factors are that we're going to make the decision and why the decisions were made. Not that there's a lot of people who never like it, but I really believe if they understand why you made the decision, the acceptance of it will be much better. And we should do a much better job in doing that.
Yeah, and I think we've always mentioned that as far as the messaging, oftentimes there's actually conflicting messages coming from within our own government, which is very confusing. And some, I just saw today, I think the Alabama governor outright came out and blasted the unvaccinated people and basically divided that jurisdiction and looking down on those unvaccinated people. And that's one of the dangerous things about leadership when you can go out and say something like that, and now you're going to put it's us against them, and it's not good either. But I did want to expand on one thing, and Doc Miscovich, I'm glad you're here. When you brought up the airborne, now it's clear, right? That in fact, I saw the report came out that it's less likely to get a contact exposure versus an airborne exposure. And today, the Department of Education came out with their new guidelines, and I kind of wanted to chat a little bit about that and get both of your opinion. But let's start with you, Doc Miscovich. This is kind of the summary, a couple of the things that concerned me, and I wanted to get your take on it. Was obviously I'm more concerned of the under 12-year-olds because we know that environment is 100% unvaccinated. But a couple of the things they did say masks are going to be required indoors and out, but the social distancing, 3 feet, and then the other part that is concerning is if you look under the additions where it says no requirement for a negative COVID-19 test or a clinician's note to return to school after isolation and quarantine. In other words, when a child is found to be positive, close contacts will be sent to isolation or quarantine, and they'll be able to come back to school without even a doctor's note. I just overall, Doc, what are your thoughts on the recent changes?
Guys, yeah, and thanks for having me. And I do want to make a comment about, how honored I'm here to be with Harry on the show. And I do want to highlight that, what is it, Harry? I know we talk half hour, an hour every day. And so it's been such an honor to consider him such a mentor to me and a friend. And I just, wait to get to our next call to discuss this. So thanks again to him. And he is such a special leader, and I just can't say how honored I am to call him a friend and to know him. On what you're talking about, I think you did highlight the one thing that I found. I've already was asked by one of the news channels to be on. I've reviewed these extensively, and I first want to come out with the overview. The higher look is they actually did a really solid job on these. You guys know from my prior shows, I'm working in multiple states for return to school, and this is a good job. This is a solid job. I think you did highlight the thing I definitely would be concerned about and would not agree with. I would want those close contacts to go through testing. So if you're a close contact, and you get sent home, well, you need to know if you convert and you get to disease. So in 3 days, you should have a test and retested. You should be tested periodically. What happens if you convert on day 6 after your contact with an individual and you're maybe an asymptomatic child, and then you're going to come back to school on the 10th? No, you're going to be actively shedding. So you guys are so smart. You did pick that up. Otherwise, here's my big issue with them. And I did send a personal note to Sarah Kimball, and we've communicated. I congratulated her because, again, these are solid, with a tad bit of conservatism, pushing the masks mandate a little further. And the big issue is we have 1 week for implementation across the entire state. And so that is the real magic in this. How do we get this out? And its implementation at the district soups level, all the teachers level, at the principals level, and more importantly, at the parents level. The parents need to understand what are these policies. So I think if they can be fully implemented, it's a real solid plan. The 3 feet, CDC blew that, a long time ago. And then when you look at our public schools, we don't have the room, and so, I think I told you guys in my last outing, I believe one of the things I would encourage the governor to do is we have this bucket load of money sitting around from the feds. we should buy every child, and they're really not expensive now because they're oversupplied, a blue surgical mask. First day, get every child with the exact same 3-ply surgical mask, have DOE create a film that everybody learns how to put that mask on, so there doesn't become any fad of you wear this nice mask, because there's a huge difference between the quality of prevention in one mask to the next. And I have a big issue with 3 feet and an ill-fitting or an ill-screening mask. So that would be a good use of commonality and communication across all lines. That one thing could significantly reduce the number of positives we have if you're wearing appropriately fitting mask. So you guys know me, I could blabble on about that, but I want the good mayor to talk, and I'm open to, I'm enjoying listening, and I'm open to answer any questions you guys have.
First of all, Doc, thanks for your kind words. But like I said, you know who I'm learning from. Before the time passes and I don't have an opportunity to say it, I was talking to a friend. I said, boy, you know, on tonight's program, I'm going to say that I wish you could have one template of a place. And because of Kauai and uh, how much you've done already, different things, in fact, a little manageable type situation of 70 plus thousand people, very well organized. To heck with the 70%, you know, of vaccination. First of all, I invite all of your viewers and listeners to talk to anyone in the medical profession in regards to why 70% and why the vaccine. I don't think you'll find anyone in the field of science, of medicine, that will deny the fact of the very difficult situation we're in. And one benefit to mankind is the tremendous strides that were made and continue to be made in regards to this vaccine. You two gentlemen, which I don't know very well, except the popularity of your show, of trust. You know, I fantasize today. If you had all the resource you need, you know, that sign you saw me holding, that was today. I was in one spot in the morning, 6:30 in the morning, to tell you the truth, and the second one downtown. And rain stopped me from staying out there, and I kind of welcomed it because I really was tired. But, you know, I would make ads every single day by every single wall of your people in the medical field talking about the vaccine and the need for it. Forget all the other information in regards to this way or that way, because some of it is very valid because of change. But for right now, there is none that I know of in the pure science of medicine that's saying, not saying, thank God for the vaccine. There's even confusion on that. And Dr. Miscovich, please again check me. You know, because one of my last messages was hang in there, Hawaii Island, hang in there. And we maintain what we have now in a low count, low positive percentage, et cetera, you know, compliance with the face mask and those things. The vaccine will be here early this year. And it did come out. But one of the things, like everything else, there's miscommunication on that we have to clear out. You know, it was innocent miscommunication. A lot of people thought, you know, there's a 80-90% chance that, I mean, you're on your side, that if you take the vaccine, you will not get the virus. And now there's people saying, yeah, you gave us half truths or mistruths, because people with the vaccine is getting it. Well, they never did say that first. You know, what they said was, you know, up to 80-90% of you who take the vaccine, if you do get the virus, your impact will be minimum. You know, they said this over and over: no hospitalization, and above all, no deaths. Can you imagine if science today created a vaccine for cancer? and said, we can't cure it. We can't stop you from getting the cancer because the causes are so multiple, but we can assure you that when you get it, you won't go in the hospital. You won't die from it. Well, that's what they're saying about this. Shouldn't we all just jump up and down with joy on that? And stop the criticism of what you said. Maybe they didn't say it clear enough for us to understand. But good Lord, I don't care how clear you make it, some people still won't hear the whole thing or forget the whole thing. Dr. Miscovich, I ask you to join me on this. If most of the people, to me, most is 80, 90% plus. And you can do it, Kauai. You're such a beautiful place and people. Then life back to normality can be there very, in a good way. Of your economy, your sports, and just life in general, especially the feel of it. Will it stop the people getting it? No, I said it will not. They will minimize its impact and then gradually. And know this, Dr. Miscovich, which was only said recently, the past 3 or 4 days, there will be other variants of this COVID. Delta is just one more of it. What will the next one be? I don't know. But at least we have that science of medicine really addressing it so we can be prepared in a better way, in a faster way in regards to vaccine. So before anything, I don't want to waste too much time, precious time of yours, to the people of Kauai. I invite all of them, set up a program for information of they trust, their personal physician. Heck, if we have to pay for it, we should find a resource to have their doctors put out ads that they wrote and approve of. House to house if necessary. We can do that financially. There's a federal funds on it. You can not maybe literally go house to house, but block to block. Kauai is 70,000 plus people. You're already vaccinated more percentage than anybody in the state. I think you're 60 something. So we're not even talking 70,000 people. The one group that we cannot of vaccine is below 11, but that will come maybe 4 or 5 months, maybe more, maybe less. But with the rest of the people being vaccinated, everybody complying with the face mask issue, the heck with the indoors, outdoors. A face mask is to prevent the spread from you, from them to you. It's aerial transmission. And it's as simple as that. So just prevention. And I think, Dr. Miscovich, if Kauai does this as a template for the world or the United States or for other counties in the state, well, how great that would be. Not taking away the criticism of miscommunication, the criticism of this or that, or timeliness, or, people playing their games of politics or whatever. I mean, that's our lifestyle. But what don't have to be our lifestyle is nobody else. I cringe the day if I have to read because now more and more young people are getting it. You remember the first thing, all of you, I'm sure you remember when it came out in February and March, aspects of the virus, it addresses the old. How about the young? Oh, right now, information shows that, the young are really not the factor.
Mhm.
Have a
Sure.
beautiful show, let's make it our goal that Kauai will be our template of 80, 90% of the people. Use your influence on your people of business and politics, everything else. Come up with beautiful ideas on how commencing tomorrow, that can increase vaccination of people. I made that sign. I called a friend of mine. I called him on Saturday, and I said, "Hey, I'm gonna go. Will you make the sign?" I told him what I want on it, And he hand carried it to my house yesterday afternoon, and we fixed it up this morning. And they're all, oh, you can do a lot of things if people want to do it. Look at you two guys. I was telling my wife, my God, what a great show to have on your island. Their goal is to have good, truthful information out to the public. So I thank you guys for doing that.
Thank you.
Well, we're just a vehicle, Mayor. We watched a couple of nights ago. We watched at least one of our viewers change her mind, and we had Dr. Lee Altenberg on, and he gave his presentation. And as getting towards the end of the show, one of our viewers came out and posted, thank you guys. I'm getting my shot tomorrow. And I think the more and more we bring out people like yourself and Dr. Miscovich and Altenberg and Capono and all of these people that come out and give factual, science-based information, that I think more and more people will see the need and the value of getting the vaccine. So thank you for that amazing, amazing commentary. Dr. Miscovich. Oh, I'm sorry. Go ahead, Charlie.
I wanted to ask an open question. How is the Big Island now with its rebound for tourism or travelers coming into the island? Because having, I assumed a new role as a security head down at the Lihue Airport. And just from where I'm standing, one, business is robust. I mean, it's bustling. But at the same token, I congratulate those who come off the plane with their mask. And, I shouldn't say but their staff that works for a company that I'm managing for. They stand on the curb day in, day out. And one of their goals, as well as other duties, is to inform people that they must wear their mask. And this is like a common thing. You got people walking from baggage claim, walking to the parking lot, waiting for a ride. And I understand, maybe they come from someplace that has relaxed the mandate, and yet over the loudspeaker, Mayor Derek Kalkami is saying that, there is a mandate in place, you need to wear your mask. And it almost seems at times that it goes on deaf ears. And, I watch the employees walk up to them nicely and say, you must wear your mask. I see sometimes the pushback, but yet I see the numbers, how much it means to Kauai. But there's almost like this trade-off that, there are numbers, but there's a lot that now seem like they don't want to follow certain rules. How is Hawaii Island dealing with that? I mean, have you seen an uptick in your visitor count, and have you seen these kind of situations going on where now people don't want to wear their masks?
First of all, the problems that everyone is having is everywhere, including the mask. And I will say this quite openly, it is our fault. From CDC level to the president's level, to governors and locals, there has been change back and forth. You have to be committed to keep up with things almost every day of the varied policies to know what is the latest. Just let's take today's news. California, our biggest neighbor, where most of our tourists come through. The governor has made a policy that all government employees, will have to be
Vaccinated.
inoculated, and those that do not are tested. Then you switch over to another state that says mask not necessary. Our tourists come from all over. It's impossible that people will not get confused or mad, and there has been cases like that. And this is why my request in regards to Kauai, and being a template, a team to not only airports but everywhere in regards to what the policies are, and put the date in, have the mayor signature under every one of them, whoever. And explain why we are different. because they're going to be, especially now, more so differences in policies so in regards to everything, including schools. I count on you two gentlemen. You know, I try to ask people about uh, how popular you guys are, you know, why. Try to see how you, excuse the words, can be used and must be used. Uh, one person at the airport talking to one person or 10 people ain't going to do it. It needs a program. You need a program that everybody will have the confidence this has the latest information for the island by the government of this place, whether it be a combination of the local and the state and the federal. And there is going to be, and this confusion will get bigger because of the vaccine, because of the opening of schools and differences of that. And it's a plea to you too, you know, that to sit down and see how you can do that for the island. I don't know what your relationships are with any of the politicians that every island has. I don't know what their attitude is of you, which is obviously very important. But we all, for the sake of our families and children, you know, when I wrote that sign, the bottom line says, for your ohana. I think you know that ohana is family, but I didn't say blood family, the whole island family. We got to join hands now because we are in this critical. The problems that the DOE people have, Lord knows, have mercy on the complexity of the decision making in regards to spacing when you don't have spacing. You know, how do you allow them to eat in a limited time and this and that and do all the work? And my goodness, you know, and they're teachers, they're principals of education. They're not experts in this kind of planning, and they've been given a limited time to do it. They need the community to work with them. Nobody, and I am not saying that we don't deserve many of the criticism of misinformation. Heck, I get that all the time, and I know that it can be better. But in this particular case, what is the end result? Death. Death to people who don't deserve to get the disease. Death to people who should have just a minor cold or something. It depends on us all, you know, people to come forward. We have 2 weeks or so before school starts. We got to put this as priority number one of getting together and see how, number one, that all of science agrees. We are so fortunate to have the vaccine. If we can get the vast majority of the people get a vaccine, we can return to life as normal as can be quickly. But most important, we can prevent people from getting ill. I don't know any of your health issues, and I'll close a lengthy conversation. I've been sick for many different things. If you know somebody, I don't care what age, that have gone through an illness, that breathing is difficult, you know the horrendous thing of every breath fighting for your air. The best analogy I saw is of people saying it's like somebody putting a plastic bag over your head. And that's what we're talking about. We gotta do everything we can to take one thing that most all of good science have agreed, the medical science. Call any of your doctors. The vaccine will not stop you from getting it wholeheartedly. It will minimize, and you know the study done overseas shows up to 40%. You know, may get it, but all of the figures in this island, the state, in the United States and elsewhere shows a minimum amount that really get sick. And, you know, the fatality list or critical list. This is what I look at you to begin a mission on that and fix the rest as we go.
Well, you know, Charlie's Charlie lost his brother one of the first deaths in New York last year. Uh, one of our, I think it's Hoku is your nephew, right, Charlie?
Mhm.
Well,
Yep.
his nephew today, and a friend of mine lost his friend. He was one of the people that passed away yesterday in his 40s. Uh, you know, Doc and Mayor, diphtheria, tetanus, polio, smallpox, chickenpox, tetanus. This is not the first pandemic that we've seen in our country or in the world. And I don't know this. I really interested in doing the research, but off the top, do you folks know if we went through the same issues with the vaccine hesitance, with any of that other uh, viruses or diseases that came through? I know, Mary, your analogy with the cancer vaccine, should they have one, and everyone would be jumping up to go get it. That really hit home. I appreciate that. But did we have this issue with any of the other vaccines that came out? I mean, we got the mandatory vaccines for kids going to school. No one's blowing up about that, but it's for some reason COVID, and I think a lot of it is because of the misinformation, because of the internet, because of all of these, misinformation. Do you, any of you know if we had these same situations with any of the other vaccines?
I can answer that, guys. The answer is no. Not, people lined up for them to get them. There had to be some, but when you talk about the percentages that we have now, the answer is no, no, absolutely not. People lined up for them, and they were in high demand, and the lines were across the street every time they were offered. So no, I think this is all from the era we're living in, and we're using one of the devices that has made this happen, with connectivity through the internet. It's just and the false information that is available out there. That's the big issue. I do want to comment on something along those lines that talks about um, the vaccines, and I watched the mayor's all on PBS, and I'm watching obviously closely all of the information, and it goes along with what Mayor Kim is saying and what you guys are saying about vaccinations. I get daily updates. I just got all the data on the Big Island today, and there are 5 regions all on the south part of the Big Island where vaccination rates are less than 35%. Think about that. That's what's going on in Alabama and Arkansas and some of those states, Tennessee, where the disease is just those countries or those states. Um, think about those areas. They're all, and the mayor knows this well, they're all down on the southern part of the Big Island. Then you have another 5 areas on the Big Island where it's less than 45%. And almost every single one of them are areas where we have large areas of conjugate housing. We have large Native Hawaiian, Pacific Island, and other Kofa Nation individuals. We have low percentage of internet and technology, and that reaches those areas. We have people who have a much more challenging social determinant of health, or their social vulnerability index, and they can't afford to miss work. um, I'm sorry, but we need our elected officials to care about them. Those are the people that are the ones that have already suffered disproportionately, because more of them have died proportionate to the population. And so we can't just say get vaccinated. There has to be very special programs addressing those individuals because of their circumstance right now. And I just think that's what we need to start thinking about broadly, and just in as we approach our state, to look at the vulnerable and to reach out to everyone to see if we can prevent them from dying. Because you guys see what's happening. 1/3 are vaccinated. It's ripping through families. It's going to continue to do that. And the more educated and affluent are going to sit back and, oh, we're okay, go, we'll go get vaccinated. Well, it's their fault to get vaccinated. now let's find a way for everybody to have equal access. And I commend the mayor for saying, you know, what you guys are doing. And there's my guard dogs. Hey guys,
Damn.
come on. So bottom line is, you guys and Janet, you've had a real solid person with Janet Berryman over there, and she basically, I saw today, there's a lot of remote vaccine sites, which is what we've been trying to start to do, and she's doing those all over Kauai, and that really makes a big difference. So that it's being brought to the communities. Don't make the people just come to you, go to them. So sorry, I'm happy just listening. I watch your show all the time just because my face is up on the corner. Yeah, I just love listening, and to, you know, he's kind of like Yoda to me, and then he's like Moses, because, you know, he's gone up to the mountain so damn many times, and he keeps getting off the mountain. You know, lightning doesn't strike him. He brings back 10 commandments. Heck, he's probably been up there enough. He's bringing back about 100 commandments, and so I just love being with Harry and listening to him and learning from him, and yeah, he guides me too. You know, in our daily conversations, he sometimes calms me down a little bit because I'm always animated as I'm going through my new data. But you know, it's just wonderful to sit here and listen.
Well, I will say this much. Before you both came on, I was sharing with Mel that, you know, when I first knew of Mayor Kim, I'm a typical Hawaiian, you know, get a little bit judgmental. I said, "Yeah, you sure this guy wasn't Mayor?" then as time went on, I had to ask the Lord for forgiveness, because I said, "Man, this guy is very methodical, and he's very wise in his delivery." And that's the reason why he takes his time when he says what he says. And he wants to make sure that his words aren't mixed up. So I thank you for that, Mayor Kim. But I did want to continue on this point that you made about the messaging, that we have to find some way, because again, I look at this whole situation as it is really a race against time, because it's moving so quickly. And I hope and pray that the government will, local government, instead of just saying, we don't want to return to a lockdown, so, just whatever that part of the message is. But I'm still a little curious about how these unvaccinated people are getting infected, whether it's from, like you said, you can have vaccinated people that are not showing signs of symptoms, but yet they may be carrying the virus. How much of it, how much of a load, I don't know. And then you have those who are unvaccinated that are contaminating or spreading it to other unvaccinated individuals. So there's a whole slew of it being contagious. It's coming from all angles. And I'm just wondering your read on what should the message be? Because, for Mel and I, we bring on the experts like Dr. Miscovich, like yourself, and we try to help share that information. And yet, as good as it can get, and as the best experts we get, it's just like we're still not enough. And I'm just wondering, what other messages can we give? Because I'm sure, and you said something so eloquently, that you must stay the course. Since COVID came out, Mel and I have been on the air. We started off every single day, 7 days a week. Then we scaled it down to 5 days a week. Then we scaled it down to 3, and we beaten up COVID so much. We were about to head in another direction. But then, of course, all of this started again, and Mel and I talked about it. He says, "Hey, brother, we got to stay on, because now it's taking a life of its own now with this Delta variant." So I just wanted to get your read on and your comments as to what other messaging can be done. If you were married today what would your administration, what would you tell your administration? This is the message we need to get out to the people of Hawaii Island. What would you do?
I'm very proud of the kind of programs that the team came up with. You know, different programs going to be come forth. I had a very short conversation with Dr. Lassiter, president of the University of Hawaii, about this policy. And he assured me that he was reviewing it because of the change of the virus. And I was so proud of Dr. Lassiter when he came out and said, you know, of the change. His initial was, you know, caution, this and that, face mask. But now he's saying that all staff and students recommended to take the vaccine and with face masks and all of that. And those that do not want to take the vaccine, you know, must subject themselves to weekly tests. Every different segment will have different aspect of what is best. I think our biggest problem is the public schools because everyone, not always everyone, but most people feel that students got to get back to school. You know, we're social beings, you know, we need that. And the biggest problem of that group is below 11 because there's no vaccine. And most of them, as you know, elementary classes are so crowded. And how are you going to get the 6 feet spacing and just to eat to much less do the work, et cetera, et cetera. This is why I think if the people of leadership of Kauai and you people who are involved in mass media type, which you're doing, who are involved in a program of communication of information in public, you know, this is not to blow smoke. This is no time for that. We have less than 2 weeks before school starts. This virus now, I look at it every day, the numbers getting, and just a few weeks ago, months ago, I would never have guessed Kauai would have those figures. I think your mayor will admit that we both kind of looked at each other. I was so envious of Kauai when it's 0, 0, 0 and all of that. You know, and we had our turn on that, but look where we are now. This will get worse if we all sit down, put away all the criticism for now, make a priority in regards to vaccination because they're spin off the benefits of that. Get your doctors involved. See who can pay for ads, who can pay for. There's no one thing, you know, maybe Dr. Kimura and Kauai can make, I will set up a vaccination in X store from 12 noon to whatever. All the small pockets of stuff that will get you over 70%, closer to 90%. That alone will be a tremendous, tremendous move in regards to making things better and minimizing the spread of this virus. I'll lay it and Dr. Miscovich, I invite you to add or subtract from it. It is airborne. Transmittal of that is so much, many times more dangerous than previous, you know, strains of this. What will be the next? I don't know. But we have to attack this one. You have to get all the people of Kauai involved.
I really got to jump in and say, you know, on Kauai and you know, we just, and Charlie and I talk about this a lot. We're so proud of our mayor, his team, Dr. Berman. Uh, we have not stopped the free testing. There's testing for anyone, no paper needed, no doctor paper, no money. You drive into the convention hall. They also have mobile testing units. Vaccinations, we're putting out vaccinations in restaurants, in churches, in, I mean, our county has, I think they're doing a super job getting them out. They were at Rob's Good Time Grill the other day, and I saw a few people taking pictures, getting their vaccinations at a restaurant, at a sports bar, and various other locations. But I mean, I think a lot. We're kind of at a plateau as far as who's gonna take the vaccine, and we're gonna pick up one here, one there. But you know, you bring up an example of how you spoke to Dr. Lassiter at the college, at the university, and he amended his policy because his policy was a dangerous one, and he adapted with because of the Delta. So he's going to require vaccination, or if not, no vaccination, then you got to test every week. I guess my only question is, why would we not expect that at our school levels, our elementary and high school levels, that if you're not vaccinated, you take a test every week? Why would not we would not expect that out of our visitors that come? My dad is in Seattle. He just posted right now a little while ago. He said Alaska Airlines has special trips to Hawaii right now, starting at $49 one way. I want to go myself and visit my family on Kauai, but I'm afraid. So what Dr. Lassiter, to me, what he's done is adjusted and adapted to this variant, and he's making it as safe as possible without lockdowns, without curfews, without any of those restrictions. But he's saying, hey, you come in vaccinated or you get a test every week. Why would we not expect that for other schools, uh, visitors? And I understand the balance, but this variant, if we don't get a handle of it, and I know we're running out of time, but I am scared that by the time we realize, oh, we should have tested more. We should have did what UH did. It might be too late.
Well,
Mel,
it's too
let
late
me.
for those that are already,
Oh,
we had a veterans home here, and for until my time is gone, I will regret we didn't act sooner. We lost 28 lives, I think, which was roughly about 1/3 of the population of the veterans home, whose families we promised to care for them and make them feel at home. And I can sense the absolute sincerity of all of you. And with that kind of sincerity, if you get certain people together, work with the DOE, work with everybody, because of the fact that you are a small community of 70,000 people, you can make a much, much greater headway, than others can, which you already have. Of the examples you gave in regards to your vaccination, then expand it a little bit more. Now, none of this conversation is that not you're not doing anything. All I'm asking, unfortunately, is you are the people that got to do more.
Yeah.
This guy is Yoda. Doc, he is Yoda. He is Yoda. That's his new name. I'm gonna call him Mayor Yoda. New T-shirt. Hey, Kirk, new T-shirt, Kirk. Mayor Yoda with Harry Kim's picture on there. I think awesome. I know, Scott, Doc, you were gonna say something. What were you gonna say? I mean, we're kind of winding on the time, but did you have something to say?
no, every time I just lose my train of thought when I listen to Harry, man. I could just sit here, listen to him. But the good news is, we'll talk either after this or we'll talk tomorrow 2 or 3 times. And so I get to,
Uh-oh.
Oh,
I do want to give him one positive. Remember when he was mayor, we had tourism open back up, and we ended up having where we were starting to fill the hotels up because the Big Island tourism numbers went up. And you guys know I'm on CNN all the time. And I was bragging about what he did on the Big Island. I probably brought it up about 4 different times on CNN as we're seeing the disease spiraling out of control. And we were so far well controlled and having tourists coming in. And it's because I remember him calling me into his office and just basically kicking my ass about 17 times to make sure I could do what I said I was going to do. And that's where we both gained a lot of mutual respect for each other. And I was just, yes, sir. But you know what? He designed a program that was world class when we were having zeros and ones and twos and threes, and it was everywhere. And the disease was everywhere, but yet we were open and everybody was saying, how are you guys doing that? And it's because of his leadership and what he did. It's been an honor to be working with him and all these things.
Hey guys, let's end on a good note. First of all, oh my God, those words more than embarrass me. Let's end on a good note. That things are not out of control at this point. The COVID, because of the Delta, is a very difficult thing to handle in school and all of that. But things are still within our hands of control and making it good. And to have you two, have a program, I guess, of your listeners Uh, I'm sure you sit down with people you respect over there and get teams together. We created 9 teams for different things. Miscovich is where we met because we wanted to increase our testing. And he made me a promise that, well, if you do this, I'll provide you all the medical kits you need. It was at that time where the state saying there were limited medical kits. And he came through with it, then I don't care how much we needed, he provided it for us. I believe that this country, this state has all the resources we need to do it. All we need is leadership like you two guys hated and getting people together to make certain kind of programs. I don't care if it's a program where Dr. Joe, who is popular, give up his Saturdays and have vaccines given here or there or whatever, block to block, anything. There's no one magic answer. Hell, if there was one, I'd have solved it a long time ago and looked like a hero. There isn't any. You guys two are two of the big answers. I'll put the burden on you two. As us local guys say, put your money where your mouth is.
Uh-oh. Uh-oh.
Yoda has spoken.
Yeah, I guess he's going to see the other side of Mel and Charlie now.
He'll see it in the closing comments. He'll see it in the closing comments.
I wish you guys were here.
Hey, I gotta tell you, Mayor, there's a ton of Big Island people that are on right now, and a lot of positive things about you are being said right now on Facebook. Our show, believe it or not, is goes across the state.
Oh,
So yes, we have a ton of you got a lot of fans that are watching right now. That's why my eyes aren't on the camera. It's actually looking at the on the comments, and yeah, I have not seen one hater yet. So you're doing well.
maybe we can talk again someday, huh?
Definitely.
Absolutely. I think, and I want to stay optimistic because you set that tone from early on. But in the next week or two, we'll see where we're at. I think once school starts, and hopefully, things work well. But yeah, we'd love to have you back on.
I'm an old teacher, and I know Jen O'Hara. You're going to think this is funny, but I even coached him football. And yeah, you got great people as our leadership. And if we join hands, we can, and we will be all right.
One of the good things about our show is obviously very informal and uncensored. General Hara has been on our show several times, and yeah, he said some things that he said, "Oops, hey, can cut that out." I don't know, but it's live.
Later.
It's live.
You ever hear the guy play the ukulele, guitar and sing? Wow.
Yeah, he's amazing, man.
Beautiful.
But we want to respect your time. I appreciate Dr. Miscovich. Any closing thoughts before we wrap this up?
No, you guys know you can count on me for any information, and I'll always come back on and just keep up the great work. And I think that listening to the words of wisdom of Harry here, are just incredible. And then to see him, it's just incredible. So thanks for having him on. Thanks for what you guys do. You guys are a gift to all of us also.
You bet.
You're making me blush. Charles, what's your thoughts, Charles?
Well, I'll say this. First of all, I'd like to thank the Honorable Mayor Harry Kim. Thank you so much for joining us tonight, as well as the Honorable Scott Miscovich, always joining us as well. Through this show tonight, I got a text message from a parent who has a preschooler, a Kamehameha schools on Kauai, different location. And she said that they're doing weekly testing now for the young ones. So I am so relieved to hear that. In fact, I'm almost at tears because we talk about how dangerous this virus can be, but yet to know, because I went to Kamehameha, and to see this parent say that my young preschooler, they get tested at the school. We have to be blessed about that. At least there's a program out there. I hope the DOE can at least adopt something like that, because yes, there needs to be that social stimulus going back into school, but we have to do it in a safe way that, because like we said before, and I said this to you before, Scott, that this virus is like the boogeyman. And the boogeyman has no place in the schools with our kids. It has to stay out. But the only way we'll know that is if we do some kind of testing to make sure that the boogeyman is not in our schools. So I just want to thank both of you for sharing and enlightening us tonight. Again, the, the the show is always open to you, Mayor. Whenever you want to come back to get a message out there, let's do it. Let's do
Well,
it.
thank you. You bet. You bet. What a tool you guys are. What a resource for Kauai people in other places of the state. So thank you for what you do.
Thank you.
Well, we'll do it again real soon, Mayor. Just to Calla Wolf. I don't know if you must remember Calla Wolf. You know how Mia, the little girl. I saw a picture today of you handing her over a resolution or a certificate or a proclamation a while back. That was really touching. This just your character is amazing. So Calla says in her post that we love you, Mayor Harry. She just posted that. You Yoda, I think is a great thing. You set us up. Charlie and I we come on about 15 minutes before the show and we do our pre-show ritual, and and then you set us on a really good attitude, and I found myself checking myself about, hey, Mel, I think he's talking to you, you know.
Hey, Mel,
Uh,
wait now. Mel, I know you refer to him as Yoda. I hope you don't think that I'm Chewbacca.
well, Chewbacca, you're Chewbacca, and someone said that Dr. Miscovich is Han Solo. That
Then
would
you,
make
then,
me
then,
that would make me Luke.
no, no, that would make you R2D2.
Hey, Mayor, don't look, Mayor, do not look. Hey, Charlie. Anyway, our mission, Mayor and Doc, as you know, is to inform and educate. That's what we do. I am planning, and I'll be talking to Charlie after the show, but I'm planning to do a special segment we've had many of our, what I call COVID survivors, that have been on our show. I'm not going to start naming them because I'll forget a few. We've had a bunch, but I want to do a special show with our COVID survivors. They're not COVID recovered. And I think, Doc, you probably know this, being a good friend of the Doc, that they never recover. They survive COVID, but COVID stays with them for a long time. So I'm planning to put together a show specifically with COVID survivors. And if you or any of you out there watching wants to participate and help us out, I actually was asked today, if we could share our resources with the Department of Health so they can make commercials with these survivors. But I want to do a special segment, and we're going to start off with Charlie, because Charlie took us on a journey that was just heart wrenching, and really kicked this thing off last year, over a year ago. So if you or any of you out there watching that, and you know who I'm talking to because you guys have been on our show, please message me. We want to set up maybe next week, and hopefully when our viewers, unvaccinated viewers, see the stories of people that actually lived like they had a plastic bag over their head, as you said, Mayor, maybe then they can think, wow, maybe I need to go get a vaccine. So that's just kind of on the plans, but we'd love to have you back, you and the Doc, and continue the discussion, guys. Tomorrow night we will have Daniel. What's the HNA guy?
Daniel Ross.
Daniel Ross from the Hawaii Nursing Association. He's the president. He'll be on sharing stories about what our nurses are going through, our frontline people. And on Thursday, a very special show. We'll have our couple of our state representatives, maybe Nakamura, Joel Yoshimura, or not, yeah, no, Yoshimura, and a bunch of housing and mediation people. Because August 6th, the mediation, or I'm sorry, the moratorium for evictions are going to go away. So we need to get our renters, our tenants, and our landlords prepared. So we're going to have a special show on that. And we're trying to lock down a few more extra guests for the rest of the week. So with that, Mayor, thank you again. God bless you and your family. Dr. Miscovich, likewise, appreciate you always being there for us. And Charlie, Chewbacca. You guys all have a wonderful evening. Stay safe. God bless. We love you guys.
Thank you.
Aloha.